Hi, I'm Dr. Balaji Datti. I'm a board certified gastroenterologist with Kansas Medical Clinic in Topeka, Kansas. As part of an audio-visual podcast series, I will be talking about inflammatory bowel disease today. First, let's talk about the definition of inflammatory bowel disease. It is defined as a chronic on and off repeat inflammation of the GI tract. Patients develop inflammation in various parts of the GI tract, especially in the small intestine and the colon, but also occasionally in the stomach, esophagus, and the mouth too. Patients can have associated problems involving the joints, eyes, and skin too. It is a chronic problem like diabetes or hypertension, which remain with you for the rest of your life. Here, the goal is to keep the disease under control. Next, what are the types of inflammatory bowel disease? There are mainly three types. One, Crohn's disease, two, ulcerative colitis, and three, indeterminate colitis. Crohn's disease involves the whole GI tract from the mouth to the anus. Patients tend to have abscesses, fistulas, or strictures. Surgeries are commonly required as part of the treatment strategy for Crohn's disease. Ulcerative colitis involves the colon only. For ulcerative colitis, unlike Crohn's disease, total removal of the colon, or also called colectomy, is curative. Indeterminate colitis is when patients have a history and symptoms and also findings consistent with inflammatory bowel disease, but we do not have a confirmation of the diagnosis on the bowel biopsy. Inflammatory bowel disease is one of the most common chronic conditions that patients visit a GI doctor for. It is seen mostly in industrialized countries, mostly in the northern latitudes than southern latitudes. The incidence of inflammatory bowel disease is rising in the country. It's predominantly seen in the Caucasian race. The age of presentation is mostly young males and females between the age of 10 and 30 years. There is also a second age group noted between 50 to 70 years of age. We see usually more females than males with Crohn's disease, whereas in ulcerative colitis, there's usually more males. What are the risk factors that can lead to the development of inflammatory bowel disease? Mainly, they are diet, genetic, and environmental. Diets high in fats have been shown to have increased risk for inflammatory bowel disease. Genetics also play a big role. Certain races and belonging to certain families can increase the risk of developing the disease. Obesity, inactivity, stress are also possible risk factors. Living in Western countries and northern latitudes also increases the risk of the disease. Questions have been raised if infection exposure in early parts of life in Asian and African countries plays a possible protective role. Smoking is certainly a risk factor for Crohn's disease, although interestingly, it seems possibly protective for development of ulcerative colitis. What are the main symptoms and signs of the disease? Abdominal pain, diarrhea, blood in stool, weight loss, skin problems, joint problems, eye problems can all part of the presentation. Symptoms can be intermittent in beginning, making accurate diagnosis difficult. Sometimes they can be acute, especially in Crohn's disease, where they can present with a bowel obstruction, abdominal abscess, or anal fistula. Presentations can sometimes be from non GI issues like arthritis, skin rashes, or eye problems like a red eye. So, how is the disease diagnosed? It is a combination of good history taking, physical examination, and utilizing endoscopy, imaging, and also blood work. But colonoscopy is the cornerstone of diagnosis. The most definitive diagnosis is obtained via examination of the colon and small bowel during colonoscopy, and biopsy of the tissue is obtained, and this diagnosis is confirmed. At times, this can be difficult to do if the disease is in the small bowel and it cannot be reached during colonoscopy. So, we rely on overall history, examination, imaging studies, and also blood work to make a presumed diagnosis of inflammatory bowel disease. Some of the commonly done tests are upper endoscopy, colonoscopy, capsule endoscopy, imaging. We do CT enterographies or MR enterographies, abdominal x rays. Blood work routinely involves a complete blood count, metabolic panel, inflammatory markers like CRP, fecal calprotectin, and also serology markers for IBD, where we do a special blood test called Prometheus IBD SGI panel. We at KMC Endoscopy Center offer EGD, colonoscopy, and capsule endoscopy that are needed to diagnose and manage inflammatory bowel disease. The disease presentation can vary at initial diagnosis, or it can change or evolve over time, needing change in plan of treatments. Again, endoscopy, imaging studies, and blood work are utilized to categorize patients into mild, moderate, or severe disease. Important treatment choices are made based on disease severity. What are the treatment options for inflammatory bowel disease? Commonly used treatments include number one, steroids, anti inflammatory medications for the colon that include mesalamine, sulfasalazine, immunomodulators like azathioprine and methotrexate, biologic therapies, and also surgery. Steroids are a common choice of treatment for all disease stages. They're especially used to induce remission or for any flare ups of the disease, although they are not a long term choice due to concern for side effects. Biologic therapies have changed the management of IBD over the last couple of decades. We will talk about this a little bit more. Surgery is also part of IBD management. It is needed for bowel obstructions, abscesses, fistula repairs, diverting colostomy or ileostomy, and as mentioned before, colectomy is considered a cure for ulcerative colitis. Biologic therapies have been a game changer over the last couple of decades. They are usually used for severe to moderate disease. They are used as a long term treatment for maintenance of remission. These medications target immune molecules that mediate the inflammatory cascade in the IBD disease pathway. Various biologics are currently available that target different immune mediators. They are available as both infusions and self administered injections. Infusions and injections are administered anywhere between every 2 to 8 weeks. The commonly used infusions are Remicade, Entyvio, and Tisabri. Injections include Humira, Cimzia, Simponi, or Stelara. Oral therapy is also available via Xeljanz. Biggest concern with biologics is potential for side effects, including risk for infections, heart, liver, and neurologic problems. Also, there is a risk for skin related cancers and a rare risk for lymphoma. Biosimilars are a new treatment option for IBD, as they are similar but not identical copy of a reference biologic but have equal quality, efficacy, and safety. A couple of them available in the market are Renflexis and Inflectra. Infusions at KMC. We at KMC do provide infusion treatments at our office. Currently, we provide infusions for Remicade and Renflexis. IBD is considered a risk factor for colon cancer. Patients with ulcerative colitis involving the whole colon and Crohn's disease involving the colon are at increased risk for colon cancer over the normal population. Especially patients with disease duration over 10 years are recommended to have serial colonoscopies every 1 to 3 years for surveillance. Patients on biologic therapies are at increased risk for non melanoma skin cancers and are recommended annual skin checks. It is not uncommon that patients can have difficult to control inflammatory bowel disease, which loses response, nor does not respond to available treatment options, including biologics. There is ongoing research to find new biologic treatments that will target new molecules in the inflammatory pathway, hoping that patients have better outcomes in their disease course. Along those lines, KMC is participating in a clinical trial for a biologic treatment for IBD. Interested patients or referring physicians can contact us at 785-354-8518 at our office to enroll patients in trials. Thank you so much for your time. I hope this was helpful.